I would say the biggest misunderstanding is that people don't realize that distal symptoms can be related to proximal pathology. Like the TM joint, if you look on a Chinese acupuncture chart, look at the meridians, there are like 4 meridians that flow by the TM joint. And in Chinese medicine, if you have a blockage in that area, you can have symptoms somewhere down on the meridian, which could be your foot. So I think that the biggest obstruction is our constant need to have a direct anatomical connection between things. And I've been doing medicine for 40 years, and I got to tell you that when we get somebody who comes in with what we call classic symptoms of anything, we get really excited. Like, look, it's classic something or other. And the amazing thing is that if you look at it, you find out that the majority of people with any condition don't have classic symptoms of anything. So why we call them classic is a bizarre attempt to make the patient fit the book, as opposed to looking at the patient. So, we're constantly looking for explanations. Medicine is always changing. I could take a real basic example nowadays like appendicitis, and that was always something that you take out surgically. Appendicitis, we take it out. Nobody ever questioned that until the last 5 years, when in Europe they started treating appendicitis with antibiotics. And sure enough, it sort of works like 70% of the time. Things are changing over time. I think a number of the doctors, like Dr. Feld, who's forward-thinking and not so arrogant as to believe everybody fits in a box, they're the ones that are going to lead us in the future, because the system that we have is not working right now. If you think that you have symptoms that are unexplainable by conventional medicine, then you need to look outside of conventional medicine and see if something else can help you. And the TM joint is clearly something that causes lots of symptoms that are distant from the jaw. So if you have symptoms and you have something like your jaw doesn't open wide, or you have clicking, or you have snoring, or you have sleep apnea, or any of the symptoms that you can say are directly referable to the jaw, then you need to be checked out by somebody who specializes in TM joint. Not your regular dentist, because they don't know about the TM joint. And you need to see somebody who specializes in that. And it's not just a clinical diagnosis, it's something that you can test for and you can prove that you have it. So it's something that can change your life if you have it and improve the quality of the rest of your life. So I think it's worth looking into.